So we are going to kick off 2024 OKRs with Martijn and Methods Research Work Group, as well as Hades. So Martijn, I'll move everyone's slides.
Thank you, Greg. Yeah, so the Methods Work Group, where we formulated a mission, is to empower real-world evidence generation through collaborative innovation in statistical and computational methods. In the past, I tried to have objectives and key results that were specific to specific research topics, but I found that that just didn't work. As you can imagine, methods researchers are an unruly bunch. So instead, I shifted the focus a little bit of our OKRs to basically facilitate the methods research that is going on, and primarily have two objectives. First of all, to promote awareness and collaboration in methods research, with as key results to maintain a comprehensive directory of ongoing methods research. I mean, I should probably mention that, as you also see for the Hades OKRs, I try to assign a lead to each key result. I'm hoping that that will help engage people and also make sure that the key results get done. So maintaining this comprehensive directory is something that I'll be leading. And actually, we've been doing that in the past year already, where at the start of every meeting, we go over this basically Excel sheet and see who's working on what and just briefly discuss that. We aim to have at least 6 presentations of ongoing methods research. So if it's published, it's actually no longer considered ongoing. The reason for this is that we want to facilitate awareness of what people currently are working on, and also can't collaborate if it's already finished. The third key result is having an average attendance of meetings of at least 20 researchers. Then the second objective is one that Lin Jing recently raised, which I think is a very important one, is that we want to be better at aligning the research topics with the needs of the OHDSI community. And we thought long and hard about how we can accomplish that. This year we'll try and perform a survey to elicit community needs, and Lin Jing will lead that. All right, next slide. Yep. So the Hades work group, or Health Analytics Data to Evidence Suite, our mission is to enable the OHDSI community to perform observational research following OHDSI best practices for characterization, population level estimation, and patient level prediction by providing a cohesive set of open source analytics software. Again, each key results, we had to have at least one person willing to lead that. That also meant we actually had fewer key results than we started with, just because not every key result got somebody to sign up. So here are the objectives and key results for 2024 for Hades. So more user involvement. We tried to do this last year as well, and I think we still need to do this better this year. We tried to specifically achieve this by basically doing what are called post-mortems on network studies. So if people run an OHDSI network study, then we want to get in touch with the organizers and find out what worked and what didn't, as it relates to Hades. For 2024, we want to document various important interfaces that our software has. So fully document the strategist inputs, fully document the result schema, so the strategist output, if you will. And Katie and Hayden are signed up to write a manifest that describes the rules for which database platforms we'll support. We also still aim to have better testing. We're not a lot of people interested in signing up for specific key results. Here, I signed up for one that's just basically the starting point is actually figuring out which of our unit tests use which database testing servers. So that's what I'll be working on, at least for the start of the year. And then finally, strategies will continue to be a major focus for Hades. The idea is to finally get strategies into Hades. Make sure that installation of strategies is less painful. That's something we learned certainly from past network studies. And also to facilitate that, probably start to look at Docker containers and execution engines. And with that, I'm at the end. Thanks.
Thank you, Martijn. I'll turn it over now to Allison Callahan.
Hi, everyone. Thanks for having us and giving us the chance to share our 2024 OKRs. So I co-lead the Perinatal and Reproductive Health Workgroup alongside Stephanie Leonard and Louisa Smith at Stanford and at Northeastern. This is the second year that this group has existed. And last year, our focus was sort of on continuing to exist. So our OKRs were mostly focused around, having running at least 10 sessions and having good attendance in addition to some specific domain-specific goals. I'm happy to report that we met those goals, and we also had a wonderful in-person session at the symposium, which was very exciting, and sort of kicked off work focusing on phenotyping, as well as getting a network study off the ground led by Stephanie Leonard, looking at antihypertensive use in pregnancy. Our overall purpose is to develop tools and standards for pregnancy and reproductive health research to foster collaborative studies within the OHDSI network and also to advance research in the field generally. It was very exciting to see the other activities related to women's health mentioned earlier in the call, and we definitely are in that space as well. Our OKRs for this year, we have 4 high-level OKRs to develop and share phenotypes for key perinatal and reproductive health factors to enable research using diverse data sources. To that end, we've started creating subgroups within the working group focused on specific phenotypes, so we're excited about those ongoing efforts. We have some exciting updates that we'll share soon, focused on our second OKR to provide training and education to perinatal and reproductive health researchers who are interested in OHDSI projects, because we've noticed that many of the people who join our work group are people who have deep expertise in this research domain and are relatively new to OHDSI. We will extend existing work to identify pregnancy episodes in data in the OMOP CDM using additional data sources like EHR data. A lot of the work done in this space uses claims, and so we want to continue to focus on EHR data as an OKR. And we will improve the transformation of data from pregnancy-specific EHR modules and also additional sources like vital statistics databases into the OMOP CDM. So those are our 4 high-level OKRs. Thank you.
Thank you, Allison. I will go next to Tina Parsiak with Registry.
Hi, sorry. Yeah, right on time when I'm supposed to start, my connection falls out. So I come freshly from our last registry workgroup meeting, where we also talked about the OKRs of our group. And in general, our objectives or our mission is that we want to build a network of registry stakeholders, I called it. So everybody who is associated with registry at one point or another in OMOPing their data to the OMOPing their data. And we want to give support for ongoing on new initiatives in transforming their data to the OMOP Common Data Model. And we mainly want to enable this support through accessible documentation on GitHub, for example, result dissemination on conferences or in the community calls, or as well in journals or in the workgroup discussions. And our next slide, please. And our key results for 2024 are that, for one, we want to have, because we keep coming up with a problem of defining what is a registry or what is registry data, and we keep coming back to it meeting after meeting. So one of the key results is that we have an overview of the difference, what I call now just shortly EHR data, so really the standardized clinical data from a hospital, claims data, so very the standardized data versus registry or curated data. We also want to have like an overview of all the challenges we already heard or we still will hear in the future when it comes to mapping that data to the OMOP Common Data Model. And we now decided in the last meeting that we will focus first on a manuscript. So we will try to work on a manuscript that focuses on the challenges reported in mapping registry data to the OMOP Common Data Model, including the definition of what a registry for us is, so that we can leverage our status quo knowledge in those mappings to a broader public, and that we can, and we also invite everybody to join the work group who has to do something with registry data. Okay, thank you.
Thank you, Tina. Final one for today is our steering work group, and that will be Patrick.
Thanks, Craig, and thanks everybody for being here and for our work group leads to kick off the month. I'm here representing our steering work group. The purpose of our group is to support the community and its leaders to collaboratively generating the evidence that promotes better health decisions and better care. And we're trying to do that by identifying, organizing, and guiding collaborative activities, facilitating communications across the community, providing inputs and operations to the OHDSI Central Coordinating Center, and building consensus on the vision for where OHDSI community wants to go together. Right now, we're trying to focus on two primary objectives centered on trying to facilitate community collaboration. We want to empower work groups to collaborate with each other. And so part of what we're doing right now, making sure all work groups have an open voice to be able to share what they're doing, to express their OKRs, and to get everybody to engage and participate is something that we're trying to facilitate to have happen. So it's exciting to see this coming. We also want to make sure that we continue our work group leader summits, and we will be trying to host one this quarter to make sure that all of our work group leads have the support they need to continue to do the tremendous service that they're doing for our community. For our objective 2, we're also looking to create collaboration opportunities that encourage more collaboration. Of course, our global symposium becomes a marquee event every year. We're excited that we've now identified a location and dates, and in the next period of time, we'll be announcing all the details there. And as you heard earlier from Craig, we're really looking forward to others joining for our scientific review committee. But we're also looking to create community collaboration activities throughout the year. And we're now kicking off Phenotype February as one demonstration of an example of something that we're trying to do to foster opportunities for everybody to collaborate with each other. If anybody's interested in joining us on the steering work group, we have our regular meetings on Fridays at 11:30 a.m. Eastern time, and would love to see you. Thanks so much.